Hi everyone, Dr. Meka here again. If you're new on this channel, welcome. Please click on the subscription button, subscribe, like and share this video so that anytime I drop videos, you'll be notified. So today I'll be looking at how to choose or select the right type of medication for patients with epilepsy, depending on which is which. Like you know that there are two major types of seizures. We have the focal and the generalized type of seizures. Not until 1857, when the British gynecologist discovered bromide, which he used on his patient while treating hysterical seizures. And 50 years later, we now have close to like 27 different types of anti-seizure medication that we use in patient management and care. But there are fundamental things to know about this. What we need to consider is, how do we select the right medication or the right treatment for the patient? How does it work? And what are the likely or possible side effects that the patient might experience while taking this medication? These are very critical to know. However, in looking into this, we know that there are generalized type of seizures and focal type of seizures. The generalized type of seizures, we know that the entire hemisphere will be engulfed. The focal type is the one that happens in just one place, one location in the brain. But if it's a generalized one, the entire hemisphere will be engulfed with fire, abnormal electrical activities that will lead to the release of chemical messenger called the neurotransmitter. And a lot of things will take place, potassium, sodium, and the rest of them. Check my previous video for this update. If you want to learn more about these generalized type of seizures and focal types, check my previous videos. So having talked about this, the first thing to consider, or the first consideration in selection or during selection of medication, anti-seizure medication, is the spectrum of the medication. We look at the spectrum of the medication. What type of um, epilepsy are we treating? If it's focal type of medication, epilepsy, there are quite a number of medication that it responds to that can treat this. Or if it's a generalized type of epilepsy, there are medications that need to be given, specific medication, not all types of medication. For instance, if you go and give a sodium channel family of medication, for instance, like these ones you're looking up here, if you give it to a patient, it will, with generalized type of seizure, it will worsen the case. And that is why it is very fundamental to know the type of seizures the patient is having before you start administering the medication. So the second thing is that epilepsy is often associated with other medical conditions. For example, if a patient is having migraine and is also having epilepsy, okay, topiramate is an anti-seizure medication which responds very well to migraine headache. And so that is why you need to let your doctor know what exactly is happening. That aside from seizures, maybe you have other things like migraine headache, so that a right medication or right treatment will be given to you. Right medication is important so that you don't just keep taking medication for the wrong reason. So you need to open up to your doctor so that they can manage your seizures or your epilepsy rightly. Another consideration is to look at the medicine, how many times you can take your medicine, or how many times is the medication given during the day. Some medication can be given like 2 times in a day or even 3 times daily. But somehow, patients might sometimes forget to take the medication. So they sometimes don't stick to the right timing of taking the medication. Therefore, if you are this kind of person who is very forgetful, you also need to let your doctor know so they can narrow down your treatment to to medication that you can be taking at least once in a day. You won't forget that anyway. At least once in a day. Instead of taking medication maybe 2 times or 3 times in a day, you can then they can narrow it down to you for you to take just one daily. So there's a whole lot of discussion about choosing the right treatment for a patient because the patient and the doctor need to agree on which is best for the patient or which one works best for the patient. And since some of the patients are women of childbearing age, it is also important to note medication that are safe during pregnancy because sometimes a woman might be pregnant, they'll be having seizures, so they'll be taking medication. So it's important to also discuss this part with your doctor as well because some medication has some if side effect that can affect the baby that you're carrying in the womb. So it might affect the fetus and there'll be defects uh, um, to the baby in the womb. So it's important to know all these things. So don't joke around with medication, anti-seizure medication, because they are very, very serious medication that we really need to take this thing serious, especially for you as a patient. Speak up so that your doctor can help you. Doctors are generally there, nurses are there also to help. So everyone in the healthcare, the job is to just help the patient. So for you as a patient, speak up. When you come, speak the truth. Be open to your doctor. Okay, it's very important to do. So another thing we need to talk about is the medication side effects. Like we know that when you start taking new medication, new treatment, you're likely going to have like some dizziness, some complaints of headache, nausea, stomach upset, vomiting, and all whatnot. But those symptoms will gradually or slowly, stop with time. It usually happens when you introduce new medication, except when it's things that affect the liver. If it affect the liver, then it's a bad thing. It means that those are chronic and long-term side effects of medication. Or sometimes if it's allergic reactions as well, could be another side effect of some medication, or what is called um, dress syndrome, or even Stephen Jones syndrome that affects the skin and other organs in the body. This should be considered as well, but it's not always in all cases. They are pretty much rare. So we know that all anti-seizure medication have its own um, side effects. Sometimes you can have these risk of suicidal uh, behavioral changes and all that, suicidal thoughts and behavioral changes. These are things that comes with medication, anti-seizure medication. So it's very, very important to discuss some of these things with your doctor. When you notice anything whilst you are taking medication, you need to consult your doctor and discuss um, further steps on what to do because your doctor will best advise you on what to do. And some anti-seizure medication can also lead to depression, they can cause anxiety for patients. So some of it are this medication up here, they can cause depression and anxiety. So some medication can also help in management of this anxiety and depression, like lamotrigine, valproate. Um, they can help with depression and anxiety. So these are some of the characteristics of anti-seizure medication. Okay, so since we all know about these uh, characteristics of anti-seizure medication, it means that treatment of seizure should be tailored or narrowed down to individual patients, not one medication for all. No, every patient is unique, and each patient should be tended to or treated in its own unique way. Now that you've learned about all this, can you please take 1 minute, click on the subscription button, like and share the video so that the next video I will drop, you'll be notified. Thank you for watching. Hasta luego.